Our final presenter who's going to take us down the home stretch is Louis Boitano. Louis is a registered respiratory technician or a therapist at the University of Washington Medical Center, where he works with Dr. Joshua Bendit in the neuromuscular clinic. Louis, welcome.
Thanks, Brad. And I wanted to take the time at the moment to thank Gladys and Angela and Rick for the opportunity to speak to you again this year. This is a great opportunity to bring together both clinicians as well as patients that can benefit from the therapies that we're talking about and the neuromuscular management that's so important. And you know, most of us that are involved as clinicians in this area, we're very passionate about the care of these patients, and we work with them a lot, so we have a lot of experience, and that is a big part of the problem, is just the lack of experience in working with patients of all different types of neuromuscular conditions that affect their breathing. So, know that every effort is being made in many areas to try to disseminate information, and there are consensus statements in the medical literature on the respiratory care of patients, both Duchenne muscular dystrophy patients through the ATS consensus statement, and that template can be used for other types of neuromuscular diseases as well, but also for perioperative care of Duchenne muscular dystrophy patients that need surgical intervention. And so again, those types of protocols can certainly be used for other types of neuromuscular disease processes. So as Brad said, I work with Dr. Bennett in the pulmonary clinic at the University of Washington. We work to try to support patients with neuromuscular weakness, and our emphasis is to use non-invasive means of respiratory support. So when we talk about interventions and using non-invasive means, these are a device or a bilevel pressure, as Angela talked about, that have to be applied and removed, and a patient is conscious in doing this, and as opposed to invasive ventilation through an artificial airway or through an endotracheal tube where the patient is under sedation. This is something you're consciously using, and this takes some acclimation to get used to using it. So the hurdle is to actually try to get to the point where it's comfortable and supportive to you. And it's been estimated that over 50% of the failure in using non-invasive ventilation is associated with the interface, the mask that you use. So the thing that I want to concentrate on today is the fact that it's really important for you as the end user to be empowered to make the effort to determine and discern what is the right mask for you. There are a lot of variables that affect what masks are going to be effective and not, and we're going to go through a lot of that, but this is something that you need to be able to make a decision unto yourself in conjunction with the clinician that works with you. So the first order of business is not to become overwhelmed by this whole process. It's a very simple process. You want to find a mask that's comfortable and least obtrusive to you. You want to find a mask that's most effective, of course, in terms of supporting your ventilation. And hopefully, depending upon your upper extremity use, masks that you may be able to apply and remove on your own. Now, there's a lot of different types of nasal facial architectures, and this kind of image on the left side sums up kind of the four major areas. This would be kind of a normal nose. This would be more of a pug nose with the nostrils up. This would be the long, narrow nose with the high bridge, and this would be the more wider, flatter nose, and you can see this in different patients here. These are all different types of facial and nasal architectures that make the job of trying to find a mask somewhat challenging, and certainly are in conjunction with the clinician that's helping you. They're going to try to steer you towards what they think is going to be most suitable for you. Other things that are affecting factors, of course, if you have allergic rhinitis, a history of nasal injury that doesn't allow you to breathe comfortably through the nose as well, or if you're a primary oral breather, you just have small nasal passages that don't allow you to breathe, a nasal mask may not be an acceptable alternative. A lot of patients have problems with claustrophobia. Putting something on your face is obtrusive. If you have claustrophobia, this is a very, very difficult process to get around, because anything that's on your face, particularly masks that impede your field of vision, are going to be very, very uncomfortable. And so this is a very significant hurdle to get past. And there are masks that are more accommodated towards this. Sleeping positions, people that move around a lot at night. Which positions do you sleep in? People that sleep on their stomachs are the most difficult, I find, to be able to get a usable mask. Patients that have spina bifida and need to sleep on their stomach are a difficult patient population to work with. Bulbar weakness, oral muscle weakness, where you can't keep the mouth closed with positive pressures, very difficult problem, and oftentimes necessitates the use of an oral nasal mask. What are you going to use that mask for? Nighttime or daytime use as well? You may want to use a mask that's less obtrusive during the daytime, a minimal amount of mask on the face that's more comfortable. Again, it's your preference. That's the primary consideration, is what works best and what feels more comfortable to you. Earlier masks, as you see here, were kind of relatively crude in that they had shells, and that's the plastic portion in front, that weren't contoured to the face. They had cushions, or the interface, what we call, which actually attaches to the facial surface and the nasal surface, that were much less pliable, and they didn't have a lot of adjustability in terms of trying to contour it and create the best fit and comfort for the facial or nasal surface. There's a lack of design in the cushion that actually accommodated the bridge of the nose, which is one of the more, really the critical pressure point in terms of comfort. And most of these masks did not have anything more than Velcro straps, and so they didn't have any buckles that would allow for ease of application and removal. The newer mask generation has addressed a lot of these issues, and in no small part due to the feedback that you as patients, as users, actually provide to the manufacturers for the use of these, or for the development of these devices. So the newer masks will have a much more thinner cushion or interface, and it's made out of a material oftentimes that's actually adherent to the facial surface, that actually seals better. The mask shell itself is more contoured. They have buckles that allow for ease of removal, and an adjustment system that allows for kind of the mounting point on the forehead for many of the masks to allow for fine-tuning of that orientation of the mask on the facial surface to allow for best fit and for comfort and least amount of leak. So you've got a lot of evolution here that's allowed for much, much better comfort and as well effectiveness of mask function. Whoops. So in getting a mask to fit is everything for you. Obviously this one's a little bit big for the person that's on it. Then your nasal facial shape is very important in terms of being able to find the mask that's most appropriate and most fitting. If you have a longer face or a smaller face relative to head size, all these things are affecting factors that the clinician should look at in terms of trying to kind of steer you towards what might be the best way to go. There are a lot of types of templates that are available to try to use in terms of discerning, in terms of both nasal height and facial height, if you're using an oral nasal mask, as well as nasal width, what would be the most appropriate. Masks in terms of sizing are not the same. Different lines, different manufacturers of masks are not the same sizing-wise. If you use a medium size in one brand of mask, that doesn't mean that you'll use the same size in another mask type. So you need to be aware of that as a user if you decide to look at other mask alternatives relative to what you're using. Just looking at the different masks that are available, again, this is the cushion or interface. That's really important because this is what's in contact with the facial surface. This, again, is in terms of the materials technology, has really improved greatly over the course of the last 10 years and allows for a lot better fit and a lot more comfort relative to the previous or earlier mask designs. These are joined in conjunction with headgears that have to actually hold the mask. When you talk about fitting a mask, A mask needs to be fitted such that the headgear holds the mask on the face, but it's not meant to be cinched up to tighten the mask. It's meant to try to hold that mask in place and let the air, in the case of these air cushion masks, actually allow for that cushion to seal. So the air pressure that you get on bilevel pressure is meant to actually allow for the adherence or to seal the mask to the facial surface. The headgear is not meant to be something that you reef on to get a better seal. And in fact, if you pull that headgear too tightly, you oftentimes will warp or affect the seal such that you've lost efficiency with seal with more pressure to the headgear. These are just the counterpart in the oral nasal masks. Again, a very thin silicone material in the cushion interface. And you can see that there's more kind of a contour in the shell. There are a lot of selections here that are available that you could use for an oral nasal mask. One thing to note is that some masks actually have a quick release strap that allow the user to be able to pull the mask off, remove the mask relatively quickly. And this can be very helpful for people who feel like they don't have a lot of control or want to be able to take that mask off and they're fumbling around in the middle of the night, they need to take it off and they can't. And this allows them a little more ease of doing that. Having said that, if you don't have the upper use of the use of the upper extremities, this can be a very daunting problem because when you can't control that mask, you lose control of the situation, and that can make you uncomfortable when you do have to wear a mask, particularly an oral nasal mask. This is a particular mask that has that strap, doesn't have the adjustment up here as these masks do. So not all masks are the same. Certainly different manufacturers have addressed different problems, but again, it's kind of up to you as the user, the consumer, to determine what type, given that there's plus and minuses, is going to be most comfortable and effective for you. With the evolution of mask design, we get gel masks. These are masks that use a gel interface that actually attaches to the facial surface. Lots of different designs, all meant to be able to help facilitate seal. And I find that some of our patients, when they've used those air cushion masks that we've shown versus these gel masks, have preferred these. Again, it's the end user that really needs to have the preference. You need to be aware of what's out there and make that decision about what works best for you. Again, in the continuum of evolution, then combining the gel with that air cushion mask interface actually provides for a system where you've got a gel that molds to the face and the air cushion that actually helps to seal. So again, we're talking comfort and effectiveness of seal in order to provide for the best support. Nasal pillows are another option for patients. This in the upper left-hand corner is an example of, or really the Adams circuit, an older kind of beginning type of nasal pillow system. These nasal pillows just fit into the openings of our nose, what we call the nares, and allow for ventilation without having to have a mask on. So these can be a very effective way of providing mask ventilation support without having to have a large amount of material in the face. So for patients with claustrophobia, these are the masks that you want to go to. Anytime you have problems with this issue of impeding on the field of vision, like this older nasal pillow mask has, and you can go to something that is more open where the field of vision is unencumbered, this will make a person with claustrophobia a lot more comfortable. They may not be comfortable with this to begin with, and they will need to use some kind of a desensitization process to help them get used to it, and you want to take this step by step. We advocate using a type of desensitization protocol that's self-directed, where people get used to the mask first while they do something that focuses their attention away from the mask, whether it's reading or watching TV or listening to music, something that takes the focus away from wearing that mask so that you get comfortable with the mask. The mask becomes somewhat secondary, you become desensitized to it, and then as you get comfortable with that, then you can actually hook the mask up to the machine and then get comfortable with the airflow in conjunction with the mask. So that desensitization helps people with claustrophobia in conjunction with using a lesser obtrusive mask. All these types of systems, for the most part, don't have anything, or these tubes can be removed to the side so that you have a relatively unobtrusive mask type. One of the things that's really important about nasal pillows is that the technology has increased greatly. The earlier types of nasal pillows could not be used at higher pressures because you'd lose the seal, but the newer, again, due to the technology of design as well as materials, the newer nasal pillows can be used in IPAPs of above 20 centimeters of water, as I've found, for patients. And so for patients that actually prefer to use this type, whereas in the earlier systems they couldn't use this at higher IPAP levels, now you've got a system that works. So that this is a more viable means of support, particularly for neuromuscular patients that have to use higher pressure support levels. So the patient with the generic good nares, no problem, nasal pillows work very well. But what if you've had a nasal injury where you've got asymmetric nares? This can be a difficult problem, and of course different types of noses don't necessarily work, and we may have to steer away from using nasal pillows. They're just not going to be functional relative to how the nares are positioned on the face. These are examples of oral nasal masks where you use nasal pillows, as Angela was talking about. This is a good system, again, because if a patient needs to have oral as well as nasal ventilation because of nasal problems, and they need a mask that's unobtrusive, this gives them an oral nasal mask that doesn't fill up the entire face as the other masks that we had previously shown. In the case of patients who have nares that aren't quite the same size, you could actually use these types of, or you've got multiple sizes of nasal, or the nasal pillows in the kit. And that's the thing about most of these systems now. These nasal pillow systems are kits that come with different sizes of pillows, so that you as a consumer, if you're using that, you can decide which sizes fit best for you. So there's other factors in decisions about what works best and what makes you more comfortable in terms of using the mask. For those patients who have thin facial, they don't have a lot of soft tissue on the face, or their skin is very fair and very sensitive, there are other things that you can do, kind of adjuncts to masks that can help you. One mask type is this cushion type of mask, which I've not had a lot of experience with. I'd asked Helen and Diana whether they've tried this or not, and whether it's worked.
It's especially good for people who have skin sensitivity to the silicone mask.
For sensitivity as far as allergies to a silicone. So this is a viable new product that's available. There are other types of liners that are available from providers that are internet providers. I think they sell through the internet, that can be used, that allow for a cushion when the silicone or just that material causes irritation on the surface. This sleep comfort care pad is a type of system that was developed that gives extra cushion on the nasal bridge in order to reduce that amount of pressure and allow for more comfort. Things that also can be done, cleaning the masks, being more fastidious about hygiene can help as far as skin sensitivity. Using alternate masks, where you use more than one mask to vary the pressure on the facial surface so that you're not using or producing or providing constant pressure, particularly for people who are using mask ventilation the majority of hours a day and night. Then having multiple masks to wear so that you vary that, maybe using the unobtrusive nasal pillow masks in the daytime and a facial mask at night. One of the problems that we encounter with our patients that have myotonic dystrophy is that they have kind of flaccid and facial musculature, and it makes for a very difficult time trying to seal the mask to the facial surface. And these types of masks can be helpful for them. This is a Hans Rudolph mask. It's a firmer type of mask. It kind of splints against the face and keeps a tighter kind of a interface to the facial surface. Both of these masks have integrated what we call chin cups, where the mask actually goes underneath the facial surface to incorporate the chin to actually hold. And we find that these can be more helpful for these patients. If that doesn't work, and oftentimes when you use these masks for a long period of time, you may need to go to more of a full face mask type. So on the left, a mask that actually goes over the nose, entire face, and then basically you're taking all the pressure away from the nasal surface as you are on this total face mask. Now, it's not a mask that a lot of people warm up to right away. They think, oh my gosh, I'm not going to wear that. It's going to be like being in a box. But in fact, people who have used this realize it's really not that bad. It can be a very viable alternative to having problems with chronic pressures on the facial surface where the nasal masks, be it an oral or a oral nasal mask, are causing problems that cannot be resolved, so a facial mask. Here's an alternative. I knew I had to make this a little bit entertaining because I was the last speaker, so here you are. This is the helmet. This is not something that's used in the outpatient setting, but it is used in Europe in certain intensive care in the hospital systems. So naturally, this was developed by the Italians. Who else but them would figure this out? I can say that. And if this isn't working, then you can do the full body CPAP. So. And I don't know where on earth this came from, but it was too good. I couldn't pass it up. One area that I've been an advocate for whenever I've gotten the ear of companies that make masks is to do something for patients who don't have the use of the upper extremities. When you have the inability to be able to control that mask, you can't put it on and take it off, that really limits you, and you have difficulty because you're reliant on somebody else for that. And this is an alternative where you use basically an orally anchored type of system with nasal pillows. Now, unfortunately, I think that the technology here is way behind the curve. This is not the best system, although it's available and there's been some positive feedback, but I've seen more negative feedback, in terms of how this works. But I think that this is an area that needs to be addressed because the neuromuscular patient population, which I have always submitted has been the greatest, received the greatest benefit from non-invasive ventilation support, even though the bread and butter of this type of therapy and equipment has been the sleep disordered breathing population. The neuromuscular patient population is really has received the greatest benefit. And I think there needs to be work on this area for people who just don't have control to be able to remove the mask. And if we can find a better orally anchored system, I think we can go a long ways towards helping a lot of people, whether it's a orally anchored nasal mask or nasal pillows like this. Least obtrusive, no headgear. A lot of people have trouble with headgear. If we can get past that by using something like this, it would be a great alternative. And of course, more easily removed when you don't have the ability to take it off yourself. Limited ability for adjustments in the systems that are currently available. And again, the design improvements are really necessary. This is a system that's available that's called OPAP. It's relatively new. I've not used it. I'd be interested in anybody that's had any experience with this. This is mediated through doing dental impressions in order to set this up. So this is a system that could only, basically it's like a mouth guard. You put this in and you've got the circuit in there. And I've looked at this, done a little bit of looking around trying to figure out whether this is viable or not. Again, it has to be mediated through a dental practice because you need to do dental impressions. It is not inexpensive, but if you're having problems with everything else, I think it needs to be looked into. The only current manufactured system that I'm aware of is a system by Fisher Paykel This system is, I've not had a lot of luck with. There's a flange in here that fits between the front of the teeth and the back of the lips, and most of the patients that we've tried this on have had a lot of discomfort having that in their mouth. You want something that's going to be effective, but it can't be too obtrusive in the mouth. And I think this is an area that also needs to be looked at in terms of technology. Just a few other things. Mask systems that are designed to limit torque. Torque on the mask is one of the biggest problems that we have. When you move your head around a lot at night and you're moving that headgear back and forth on your pillow, it's going to pull on that mask one way or the other. These are just different types of masks that have been designed to accommodate that. There's a rail here that fits, a movable rail that goes back and forth. As you move the mask or move the head back and forth and the headgear moves back and forth, the mask should stay stable on the face. That's what the design is intended to do. This is another type of interface where there's a large flange in here and allows for flexibility so that when the mask moves back and forth as the headgear pulls, that interface, that cushion stays squarely on the facial surface. So these are mask considerations that ought to be thought about if a patient's having problems with mask torque, where the mask is being moved and causing a lot of leak. Okay. So is it all about the mask? I would submit that it's not. There are other things that need to be done. And again, you as users need to be aware of these things because there are things you can do to help. Mask headgear cushions can be helpful. Hose support devices and CPAP pillows. These are an example of different types of mask pad accessories. There are pads that go on the forehead portion of the mask, pads that fit on the sides of the straps to prevent irritation, even for nasal pillows. As a user, CPAP user myself, I have this kind of system. Got rid of those lines, those telltale lines that would stay on my face for half the day because they wouldn't go away. And this actually is comfortable, but it also actually makes the headgear a little bit more snug to my face, but not like it's tight. It's very, very comfortable. And I believe that there's a woman in Georgia or it's in the Southeast who actually came up with this called Patacheek. No endorsements, but believe me, as a user, I find this to be very, very helpful. One of the things that's really interesting is when you see the advertisements for a lot of masks that are available from different manufacturers, they're showing these people that are sound asleep, laying in bed, and they've got the mask on and they've got the hose coming off over the top of the pillows. And I would submit that that is a recipe for problems because most people don't stay in one position when they're in bed. They're moving around. Those covers get moved, everything gets moved. Again, that circuit is going to be a source of torque on the mask. That circuit's laying on the bed. As you move your head, that circuit has to move with you. It's not going to move if it's lying between sheets or whatever. And so using something in a device that actually supports the circuit off the top of the covers, as in this case, so you get rid of this problem where it's tangled. So it reduces the potential for entanglement and decreases that torque. There are a number of different devices that are out on the market. This is one of them, called the Hoser. I love that. Again, just the application, you can put it between the springboard and the mattress, and this works really well. You can't see this very well, but this is one that's really interesting. This person has some kind of an anchor on the molding at the top of the wall, and it's just holding some kind of a cable down and holding or suspending that mask. So now, if you've got that mask or that circuit suspended above you, you can move your head back and forth as long as you just have enough play in there, and you won't have a problem. I've got so many patients that I've suggested this to them, and because of this problem, this chronic problem of mask torquing, that once they've done this, it's resolved the problem considerably. And on a personal note, this is my bedroom, and this is a piece of vinyl tubing about 1 inch in diameter that I slit linearly and just put it over the top of the headboard with my CPAP, and I've got a pillow that's concave, and I can move my head back and forth, and I never have a problem with dislodging the nasal pillows from my face because I've got a slider and the hose can move back and forth. It's, you know, a lot of this is, what's the problem? What can I do to fix it? Use your own ingenuity. You're not the person that has to go to the therapist every time to ask about this or that. Sometimes you just have to troubleshoot the problem yourself and make the best decision about what might work. CPAP pillows can be very effective there are a number of different designs that are on the market and it can be used. And so for those patients, particularly those patients with face masks, where if you put your face in that pillow, it's going to most surely torque that mask and start to develop discomfort and air leak. You're not going to be comfortable with that. So these CPAP pillows can be very helpful, and there are a number of different designs, again, on the market. This one actually has incorporated kind of a holder for the circuit as well. But again, it's all relative to what your sleep habits are and how you move, how you position yourself. Don't forget the chin strap. It's important, if you're using a nasal mask, to find a chin strap that works for you, because the mouth, muscles of the jaw will relax when we fall asleep, the mouth will fall open oftentimes, and this will reduce greatly the efficiency or the effectiveness of the pressure support we're trying to get for nighttime ventilation. It's important to have a chin strap and find one that works best for you if you're using a nasal mask. I kind of gravitate to this now that I don't have any hair on my head because I could have something to insulate with. Something that's overlooked a lot is the air conditioning system for your BiPAP. When you got heated humidification and that higher temperature air flows through the mask in a cooler environment, and a lot of people like to keep their sleeping area cool at night, that temperature as it cools through there will cause condensation and rain out, what we call rain out into the mask, and people will get a face full of water and they're not happy about it. So different types of options available are insulators. There are a lot of internet suppliers that provide these. They come oftentimes in different levels or thicknesses of insulation relative to what you might need, and even designer types. What's important is that these are not always available through the provider for your CPAP equipment. $15 investment or so will give you the ability to decrease this. The technology on this is improving greatly, and there will be systems out in the future. In fact, there are systems already on CPAP, I believe, right, that actually have heated wire circuit systems that allow for maintenance of temperature. But this is an important factor. A lot of people don't adjust this like they ought to. This is entirely within your control. The patient that's, falls asleep at night with a mask on and wakes up and it's not on their face oftentimes can be associated with developing nasal congestion because you didn't have enough humidification going on, cause nasal congestion. You can't breathe through the nose. You rip it off in the middle of the night. A lot of the problems with rhinitis and congestion are can be basically solved or addressed by increasing the temperature in that heated humidification system, allow you to be able to use it more comfortably. It's your air conditioning system. You're getting this extra airflow. You need to warm and moisten that air so that it comes to you and doesn't create dry mouth or dry throat or nasal congestion. And this can oftentimes be different relative to the time of year. But you are the end user. You need to adjust that. If that in and of itself doesn't work, there are other alternatives. Using the use of nasal sprays, saline nasal sprays, or saline rinses can be a benefit. If you still aren't addressing the problem, or you've not solved the problem, your physician may be able to actually prescribe nasal steroids for you to actually help address this issue. Angela was talking about masks that are used without a ventilator that has a leak in the circuit, what we call volume cycle ventilators. All these types of masks have some kind of a colored either shell or tube, and these are the types of masks that are to be used for volume cycle ventilation only. unfortunately, there's not a lot out on the market yet. This is something that's been used more on the inpatient system, and they're not always been available so much on the outpatient side, but I think over time and the evolution of more non-invasive support in the outpatient setting, there'll be more and more of this type of application available. So it is a evolving process. Non-invasive ventilation hasn't been out that long. It's still kind of the new kid on the block. So it's a kind of thing that needs to be addressed. And there's a lot of technology going into it. So be aware of the alternatives of vented masks that are available through manufacturer websites and also CPAP equipment providers, their websites. There's a lot of masks out there. People get prescribed masks and they don't give it a thought after that, and their mask wears out. I've seen people come in with masks that are all duct taped together, didn't know that they could get another one, or didn't know that there are other types of masks that are available. Be aware of this. Look on the website and see what's available. Manufacturers do a great job of providing the different types of masks, and you can get a lot of information, clinician and patient user information. Be aware of the accessory equipment available to the mask supports, the pads, the hose systems. Troubleshooting guides are also available on the websites from different manufacturers. So there's a lot of resource that's out there. It's important. Also, mask fitting videos are available, and YouTube has actually become more of a, it's kind of matured. It's become more of a user-friendly site for availability of types of instruction and how to apply these and actually fit the interfaces correctly. And this is really important because reading literature doesn't do it. You need to have something where there's a stepwise process that helps you. So this is very important. These are all things that are available, resources that you need to, as a consumer, use to be able to help yourself do the best job you can in conjunction with a clinician that helps you. So the one thing that I want to end with today is that I've got clinicians here, respiratory therapists like myself, and patients. I've been dedicated to working in this area with Dr. Bennett for a long time, and to me, the neuromuscular patients are an underserved population. But for us as respiratory therapists, I would submit that with the diagnostic testing, the application of respiratory aids, and the management of those ongoing, you as a patient population, everything that's done for you, for the most part, with the exception of medications and physician management, all that falls within the scope of practice that we have as respiratory care practitioners. And we are the people that really need to partner with the physicians in order to be able to provide you, the patients, with the best support that you deserve. So we've always been working in this area, and again, it's an ongoing process. And we ourselves have been frustrated by this, that things don't evolve as fast. But know that there are a lot of people out there in the country, around the country, that are working in that direction all the time. Thank you. So how far over am I?
Okay, first question up here.
Yes, I was wondering, since I'm one of those wonderful permanent belly sleepers, what kind of a mask have you found to be most successful in that?
I think the nasal pillow masks, as I found, the least obtrusive mask because you're on your face, and there are pillows that allow for the ability to have those contours, where you can be in a position where you find that the smallest mask, the nasal pillow mask, and a contour pillow can be the most effective way to get past that problem or manage that problem.
Question.
Actually, it's just a suggestion. I go to an AWAKE meeting, AWAKE. It's basically for sleep apnea patients, but it's a support group, really. And you get the benefit of other people's experience with masks and interfaces, whatever. And I don't know, the one I go to, actually there's often many, many masks there to take a look at, try on, whatever. So you might just go on the internet and see if there's an awake group somewhere near where you live.
Yeah, good suggestion. Yes, sir.
2 points.
Just a moment. Let me get the mic to you.
First of all, I use a nasal pillow and have found that mask to be most ideal. And as far as sleep, I sleep on my side, so I have no problem with the mask interfering with that. I don't feel it at night. I use a rest med nasal pillow mask, and it works. I can't understand why the therapists don't recommend that type of a mask to start with before they start with all the face masks. The second point is that you had a lot of different ways to hang up the hose and all that sort of thing. ResMed takes care of that. My hose goes behind the bed, comes in under the pillow, but from the heart tubing to the mask is taken care of by a real light, flexible hose up to the mask. And it's so easy to put on. It's just put a strap behind the head and pull it on, and that's it. And the flexible hose makes it easy to use.
Well, no argument. Of course, the mask that you're talking about is the newest permutation of the nasal pillow system that ResMed has done, and that's an improvement in design technology. As I said, there's always going to be an improvement, and that's a good thing. We're all going to benefit from that. But I think what's important is that you like nasal pillows, but that doesn't mean everybody else should like nasal pillows. There are a lot of people who use other types of systems, and have used nasal pillows and found them to be unobtrusive, or found it to be obtrusive, pardon me. One of the patients, or I should say the biggest patient complaint that I get with nasal pillows is that when you're using a mask, that air flows in around the mask into the nose. When you're using nasal pillows, that air flows directly into the pillows, directly into the nares of the nose, into the nasal passages. And some people find that to be very obtrusive, that it's too much airflow. And so again, it's very, very user specific. It's what you feel comfortable with. So what one person thinks is the best thing since sliced bread, another person can find to be very irritating. So it's all very user specific.